Hello, my name is Dr. Jonathan Howard, and welcome to another installment of Things Doctor Said. This will be another episode of Things Dr. Vinay Prasad Said, and today we're going to try to answer the very difficult and controversial question, which is worse and more concerning, a lab value in a child who feels fine or a child who is killed or hospitalized by COVID? So essentially this is what we're trying to answer. A lab value in a kid who feels fine, a kid intubated with COVID. Which is worse and which is scarier? So we're going to start off by watching a video from February 2021. As Dr. Prasad acknowledges, there was no data about the pediatric COVID vaccine at the time. That came out several months later, which I will get to. But here, Dr. Prasad has already made up his mind about it. He doesn't feel that children need this COVID vaccine because the side effects will be too great. So although he claims to follow the data, the science, and the evidence, his mind was made up months before there was data, science, and evidence. And he is going to use, and I will explain why, a fake, bogus statistic that COVID only kills 1 in a million children. Let's have a listen.
We do not know what the side effects will be in kids. We just don't know because we don't have the data yet. And there are differences around dosing, and there are differences around how kids may tolerate it. They may tolerate it differently, maybe even better. It's possible. But let's assume they tolerate it the same as they tolerate Moderna dose 2 in adults, the same sort of rates of AEs. I think we're talking, and I think I documented the piece, we're talking about grade 3 fevers, which is like, I think 104 degrees for less than 24 hours, and grade 4, which is 104 degrees for 2 days, for more than 24 hours. We're talking about of a million kids, you might take that risk of death from one, and let's say you drop it to zero because there's a 95% reduction in COVID, and there appears to be almost a full protection against severe COVID. So let's say to save that one life, you got to inoculate a million kids with vaccination to save one life. And you're talking about maybe 14,000 kids suffering grade 3 fevers and maybe 880 suffering grade 4 fevers, which is, more than one day. And I guess when you add in the myalgia, when you add in the arthralgia, when you add in the sort of headache, the fogginess, all these things, I mean, I think you have a tough sell. You have a tough sell to parents. You have a tough sell to the public to tolerate that level of side effects to avert a very rare outcome.
Okay, so there's a lot of things wrong there. So first of all, the 1 in a million statistic, which I will get to, the idea that the only purpose of the COVID vaccines was to prevent death, not severe disease, hospitalization, or long COVID. And Dr. Prasad is already poisoning the well, poisoning the public against the idea that children need a COVID vaccine. So he said, oh, you're going to have a very tough sell, as if that wasn't his main accomplishment during the pandemic, to encourage unvaccinated children to repeatedly contract COVID. So let's talk about this 1 in a million statistic. It was obviously false. There are 74 million children here in the United States. If COVID only killed 1 in a million of them, this would mean that only 74 children would die if all of them were infected with COVID, when in fact, in January 2022 alone, COVID killed double or triple that number. It killed around 150 to 200 children in 1 month alone. Although that statistic was bogus even when Dr. Prasad said it. According to the American Academy of Pediatrics, 227 children had already died of COVID when Dr. Prasad said the death rate was 1 in a million. And as you can see here, they weren't even collecting data from all 50 states. So maybe I'm old-fashioned, but I think doctors should try to communicate accurate statistics with the public. And if they make a mistake, as I have and will do again, to immediately acknowledge the error and to thank the person who pointed out the error. Dr. Prasad has never acknowledged that he has spread bogus statistics, and he has continued to do so. What about the data that came out immediately after this, Dr. Prasad made that video? So a randomized double-blind placebo-controlled trial was published, and it said, among participants without evidence of previous SARS-CoV-2 infection, no COVID-19 cases with an onset of 7 or more days after dose 2 were noted amongst the Pfizer vaccine recipients. and 16 cases occurred amongst placebo recipients. The observed vaccine efficacy was 100%. Obviously, the vaccine is not that powerful now, but multiple studies from around the world have since shown that the vaccine has limited rare but grave harms in children. This study came out at the start of 2024. The article said, real-world analysis, COVID-19 vaccine is strongly effective for children and adolescents during the Delta and Omicron waves, and it said that cardiac conditions did not increase. So just to read a little bit from this article, it said that when the Delta variant was emerged and became dominant, 12 to 20-year-olds who received the vaccine were approximately 98% less likely to be infected or have severe disease compared to those who did not receive it, with no evidence of increased cardiac complications. Then, during the Omicron wave, it said among adolescents, those who were vaccinated were roughly 86% less likely to be infected compared to unvaccinated peers, and their protection against severe illness and ICU admission was also high, being approximately 85 and 91% less likely, respectively, than the unvaccinated. And as I said, there's multiple studies showing this from around the world. And COVID hospitalizations can be severe for some children, depending on the variant. Between 10 and 25% need ICU level care. The Delta wave was probably the worst. Between maybe 5 or 6% need mechanical ventilation and to be intubated in the ICU. So some of these children can be very, very, very sick. But let's listen to how Dr. Prasad discussed children who were hospitalized with COVID, and this was immediately after the Delta, or at the tail end of the Delta wave, which impacted children more than ever before. And was Dr. Prasad concerned about this at all? Well, let's listen to his words. He's going to start off by talking about outdoor masking. That's not my issue. I'm in no position to defend outdoor masking, but let's just listen to hear what he had to say about children hospitalized with COVID.
I think it's fair to say, it's very plausibly the case, that masking outdoors didn't help anybody because outdoor transmission of COVID is so fleetingly rare.
Even with Delta.
Even with Delta.
Yeah.
Outdoor transmission is not the place where it's happening. That's one. Two, children. Children have much lower risk of acquiring the virus and lower risk of bad outcomes. There's an elegant study that Alistair Munro tweeted from the United Kingdom that looked at the risk of hospitalization for COVID based on whether or not you're vaccinated and based on your age. And it really shows that kids under the age of 18 who were unvaccinated, or kids under the age of 12 were unvaccinated, their risk of being hospitalized with COVID is less than a 40-year-old who was vaccinated. So why are we imposing such burdens on them if the 40-year-old would happily go to a bar, happily fly across the country, happily go on vacation to Hawaii or wherever? Why are we imposing such great burdens on children? It's irrational.
All right, so this was a very common technique to say that COVID posed a much greater risk to adults, which is true. Therefore, we should do nothing to protect children, which is obviously a nonsense argument, but it was a very, very common one that Dr. Prasad employed. And immediately after this video was made, well, let's just actually look at what was happening on the ground at this time, because this same day that Dr. Prasad made this video, this article was published. Every day, hundreds of kids are getting hospitalized with COVID. So at the same moment, COVID was sending hundreds of children to the hospital. Dr. Prasad was talking about a very eloquent study that showed 40-year-olds were at more risk, which, so what? And immediately after this, 4 months later, the Omicron variant arrived, and that was even worse for children because it was much more contagious. And as I already alluded to, January 2022 was the worst month of the pandemic for children. At the peak of that, according to the American Academy of Pediatrics, 6,500 children were sent to the hospital in a single week. And thus far, 234,000 children have been hospitalized overall, or really during the first 4 years of the pandemic. And all of that would have been much worse had we listened to anti-vaccine doctors like Dr. Prasad, and no children were vaccinated. So that's what actually happened, and it all would have been much worse without the vaccine. So why do I call Dr. Prasad an anti-vaccine doctor, aside from the fact that he has repeatedly encouraged unvaccinated children to get COVID? Is just listen to this. This is how he talks about vaccine side effects. Here he's going to be talking about subclinical myocarditis, which isn't really even myocarditis. This is a child who feels totally fine and has their blood drawn as part of a study, and it showed an elevated marker that is sometimes associated with cardiac injury, an elevated troponin. So we saw Dr. Prasad brush off death by using fake statistics. We saw Dr. Prasad brush off hospitalizations in children by saying that it was worse for adults. But listen to how seriously he takes this, an abnormal lab value in children who feel totally fine.
It's myocardial injury after COVID-19 mRNA booster vaccination. He makes this good point. Evaluating the true incidence of subclinical myocarditis is of major importance. This information is required for informed decision-making for patients, physicians, and public health authorities, given the apparent need for repetitive, possibly yearly booster vaccinations for billions of humans worldwide with no end in sight due to diminishing protection months after the last COVID vaccine. So why does it matter? Even if a little bit of heart muscle is dying, if you're doing that year over year over year, Dr. Mueller is concerned, what is going to be the implication on the cardiac function? What does that mean?
Okay, so theoretical harms from the vaccine are treated with much more gravity and seriousness than actual harms from COVID. Can COVID cause subclinical myocarditis in children? Absolutely, it can. There are studies of children who went to the emergency room and had their blood drawn, and it showed elevated levels of troponin. Can a game of soccer elevate troponin in children? According to this study, the answer is yes. So maybe we should discourage children from playing vigorous games of soccer. And listen, maybe Dr. Prasad is right. Maybe subclinical myocarditis is going to turn out to be a big deal, and this video will look stupid in 10 years. But he's talking about, again, purely theoretical harms while brushing off everything that the virus can do. And as always, it's important to remember that this had real world consequences, that this isn't just, relegated to Twitter, into YouTube videos, into social media. People are listening to what doctors have to say, and they are acting on it. So this study, or excuse me, this sad headline came out in September of 2021 as well. College student dies from COVID after mom encouraged, threatened, and nagged him to get vaccinated. This is about a 20-year-old North Carolina college student. And his mother said, he rationalized that a healthy 20-year-old that gets it won't get that sick. I cajoled, encouraged, threatened, and nagged him to get vaccinated, but he was too busy and or concerned about, quote, possible long-term heart issues. He finally agreed to get it as soon as he moved at school. He didn't get the chance. Now, obviously, I have no evidence that this poor college student listened directly to Dr. Vinay Prasad, but this is a consequence of doctors treating theoretical harms from the vaccine, even mere abnormal lab values, as a fate more concerning than actual COVID harms, including hospitalization and death. Thank you for listening.